I'm Lori Jinkins, and I represent the 27th Legislative District, which is most of the city of Tacoma and the entire city of Reston.
Today's topic is medical debt. How is this debt impacting families in Washington?
Well, first of all, medical debt is the number one reason for bankruptcy, both here in Washington and across our nation. It's a huge issue with regard to whether or not people can actually pay their bills, their other bills, when they have a huge amount of medical debt that they accumulate.
How does a person end up accumulating so much medical debt without even realizing it?
Well, part of the issue is that when you walk in to get medical care, either to an emergency room or to your physician's office, you have no idea how much you're going to be charged for whatever kind of procedure you're going to have. So it's kind of the same thing as walking into a store and just handing over your credit card and letting them charge you anything that they decide to charge you for whatever you decide you want to buy. You would, of course, never do that, but that's kind of what we're required to do in order to get medical treatment.
What is prejudgment interest, and how would eliminating it reduce medical debt for people?
Well, so right now, if you walk into an emergency room, from the minute that you walk in and you get your first treatment, you can start being charged interest even without you knowing what you're being charged for. That is prejudgment interest. Post-judgment interest happens after you've actually settled upon what is it you actually owe for a treatment. That's post-judgment interest. But prejudgment interest happens before that, and you can start accumulating interest right away, even months before you see a bill. You're already accumulating interest. And that's one thing that we're trying to get rid of this year.
So you've got a bill this session that would address staggering medical debt. Name specifically what it would do.
Well, there's a whole bunch of little pieces to it, but just to give you some examples. First, there's a lot of people who wouldn't owe any debt at all because they're eligible for charity care. And it would make sure that folks get notice that they can apply for charity care before they actually have to start paying any medical debt. The second one is making sure that prejudgment interest, which we just talked about, isn't charged for at least 40 days after the debt goes to collection, so that you have time to kind of settle on what you really owe and maybe start making payments on it. The third thing that it would do is make sure that your debt collector, if you've been sent to debt collections, cannot report this debt to a credit reporting agency for 180 days after they receive it. This is important because a lot of times if people have a medical debt, it really negatively affects their credit rating across the board. Finally, it also makes sure that you get more information about the debt that you owe. So often people get some sort of claim and they don't even know what it is. This bill would make sure that you get specific information about your debt so that you can trace it back and make sure that it's actually yours and that you owe what someone says you owe.
Will this actually help prevent more bankruptcies in our state?
Oh, it absolutely will. It'll really help people both maintain their health and maintain their pocketbook. You don't want people who aren't going to get medical care because they just don't have any idea how much it's going to cost and they're afraid for their finances. At the same time, you want people to really know the costs that they're incurring so that they can address them as they incur them. So I think of this as a good bill to, again, help people's health and help their pocketbooks.
Where can people get more information?
People can go to my legislative website or just go onto the web and look up House Bill 1531, and you'll find it there. You can get a full copy of the bill and then look at some of the testimony that we had. We're having a hearing on the bill very soon, and then follow how it travels through the legislative process.